If you're dealing with peripheral neuropathy, one of the most frustrating things is not knowing why. Why did this happen to you? Why your feet? Why your hands? Why your legs? Why now? And here's the thing, the why actually matters a lot because the cause of neuropathy influences how we approach your recovery and treatment. Two patients with identical symptoms can have very different root causes, and a treatment plan that doesn't account for that is going to be less effective than one that does. Hi, I'm Dr. Rebecca Gibbons at Acupuncture and Wellness of Pensacola. In episode 1 of this series, we talked about what peripheral neuropathy is and how conventional medicine typically falls short just because they may not have the tools to do so. Today, we're going deeper. We're going to go into the 5 most common causes I see in my clinic and what each one means for your path forward. So while you're listening to this, I want you to watch this and think, which of these sounds like me? Because understanding your own situation is the first step to actually changing it. So the 5 causes I see most often in my practice are: number 1 is diabetes and blood sugar dysregulation. Number 2, it's chemotherapy and medication toxicity. Number 3 are vitamin and nutritional deficiencies. Number 4, autoimmune and inflammatory conditions. And number 5, what we call idiopathic neuropathy, which can be the most frustrating because it means the causes can never be identified. Now, some of you may have more than one of these at play. That's actually very common. So let's go into each one. So, diabetic peripheral neuropathy is by far the most common cause I see. And it's the most common complications of diabetes overall. It's estimated that up to 50% of people with diabetes will develop some form of neuropathy over time. Here's what's happening physiologically. Chronically elevated blood sugar damages the small blood vessels that supply your peripheral nerves with oxygen and nutrients. Without that supply, the nerve begins to deteriorate, particularly the long, thin nerve fibers that travel all the way down to your feet. This is why diabetic neuropathy almost always starts in the feet and works its way up. What I find important to say here, and something a lot of patients are told, is that you don't have to have full-blown type 2 diabetes for this to happen. Prediabetes, insulin resistance, and blood sugar that spikes and crashes regularly can also cause or accelerate nerve damage. I've seen plenty of patients who were told their blood sugar was borderline and didn't think that they were at risk, and yet there they were. What does this mean for recovery? It means blood sugar management is part of the conversation, not separate from it. We can treat the nerve damage directly, and we do, but if blood sugar continues to damage new nerve fibers faster than the body can heal, progress will be slower. We work with patients on a holistic looking at the whole picture. So the good news, diabetic neuropathy is one of the causes that responds very well to our management program. Improved circulation to the nerve tissue combined with the right therapeutic approach can produce meaningful recovery, even in cases that have been progressing for years. There's always hope, as long as we can get that blood sugar regulated a little bit. So the second cause is one that is chronically underaddressed in conventional oncology, and it's something I feel strongly about. So chemotherapy-induced peripheral neuropathy, or CIPN. Certain chemotherapy drugs, particularly platinum-based agents, are toxic to peripheral nerves. They damage the nerve fibers directly as a side effect of killing cancer cells. And because the priority during cancer treatment is survival, neuropathy often gets minimized, or it's not as high of a priority, which is understandable. Patients are told it might get better after treatment ends, and sometimes it does, but oftentimes it doesn't. So I see patients who finished chemotherapy 2, 3, 5 years ago and are still dealing with severe neuropathy. They survived their cancer, which is remarkable and worth celebrating. And now they can't sleep through the night because of burning feet or tingling or just an uncomfortable feeling. That is not acceptable, and it shouldn't be acceptable to anyone. And that's where we come in. But also, other medications can also worsen neuropathy. There's certain antibiotics, HIV medications, statins, and even some blood pressure drugs that I've seen that affect nerves. So if your neuropathy is starting to worsen around the time you began a new medication, that's worth noting and discussing with your doctor or whoever prescribed that to you. For chemo-induced neuropathy, often the program has helped significant number of post-cancer patients recover meaningful nerve function. So acupuncture has been studied specifically in the context of CIPN, and the results are very, very encouraging. These patients often have a very good prognosis with the right support. They just haven't been pointed towards it. Not many. The third cause is one that surprises a lot of patients because it can be both a primary cause and a compounding factor on top of other causes. So the third cause is nutritional deficiency, particularly vitamin B12. B12 is essential for maintaining the myelin sheath or the protective coating around your nerve fibers. Without enough B12, that sheath starts to deteriorate and nerve conduction slows or breaks down. The result is symptoms that are nearly identical to other forms of neuropathy: tingling, numbness, burning, and balance problems. So B12 deficiency is especially common in older adults, in people who take metformin for diabetes, which also depletes B12, and people who have had gastric surgery or follow a plant-based diet without supplementing. It's also frequently missed because standard blood panels don't always test for it, or they use reference ranges that are too wide to catch functional deficiency. So other nutritional factors can include B1, which is also thiamine, B6, vitamin D, and magnesium, which all play roles in nerve health. If you've ever had a comprehensive nutritional panel done, that's worth asking for. The encouraging thing about nutritional deficiency neuropathy is if it's caught and addressed, it can respond faster than any other types because the underlying driver is correctable. Our approach looks at the whole patient. We're not just putting needles in and hoping for the best. We want to understand what's driving your specific case. The fourth cause is autoimmune and inflammatory disease. And this is a category where patients also often feel the most dismissed because the connection between their diagnosed autoimmune condition and their neuropathy isn't always made explicit by their doctors. Like rheumatoid arthritis, lupus, Sjogren's syndrome, and vasculitis can all directly damage peripheral nerves, either through chronic inflammation or through the immune system mistakenly attacking the nerve tissue itself. Celiac disease, which underdiagnosed or poorly managed, is also a surprisingly common cause of neuropathy that goes under-recognized. When we look at fibromyalgia and chronic fatigue syndrome, they are also mentioned here because they aren't classic autoimmune conditions, but they involve dysregulated nervous system function that can present with neuropathy-like symptoms and often respond very well to a kind of integrative approach. Post-viral neuropathy is also something I've seen a significant increase since 2020. So viral infections, including COVID, can trigger immune responses that damage peripheral nerves. If your neuropathy started or significantly worsened after a viral disease, that's a relevant piece of your history. For autoimmune-driven neuropathy, our treatment approach is particularly valuable because acupuncture is one of the few interventions with evidence behind it for modulating immune and inflammatory responses, not just managing it. We're working with the body's own regulatory system, not just masking symptoms. And so the fifth cause, which is technically not a cause at all, is idiopathic neuropathy. Idiopathic simply means we don't know why, and it accounts for somewhere between 25 and 40% of all peripheral neuropathy cases. This is something I also see frequently. So if you've been told your neuropathy is idiopathic, I want you to hear two things. First, you're not imagining it. Your symptoms are real and measurable. The fact that a cause wasn't found does not mean that there isn't one. It often means the workup wasn't comprehensive enough, or the cause is something that conventional testing just hasn't been able to catch. So, the second thing I want you to know is not knowing the exact cause does not mean we can't treat it effectively, because regardless of origin, what we're dealing with is compromised nerve tissue and disrupted nerve signaling. And our treatment approach addresses exactly that: direct, systematically, and with real results. In fact, some of the most dramatic recoveries I've seen have been in patients who were told their neuropathy was idiopathic and therefore untreatable. The body's healing capacity is remarkable when you're given the right support and the right foundation for it to heal. So, 5 different causes: diabetes, chemotherapy and medication toxicity, nutritional deficiencies, autoimmune and inflammatory disease, and idiopathic, the unknown origin. What they all have in common is this: damaged peripheral nerve tissue that has lost its normal function. And what our treatment program targets, regardless of which category you fall in, is supporting the nerve tissue directly, improving circulation, reducing inflammation, stimulating the body's own neural repair mechanisms. In the next episode of the Neuropathy series, we're going to talk about something that surprises almost every new patient I see: why the medications most commonly prescribed for neuropathy are not actually treating your condition. They're masking it. And understanding what distinction might be the most important thing you learn this entire series. Make sure you subscribe so you don't miss it. And if any of what we talked about today resonates with you, if you've recognized yourself in one of these causes, I'd encourage you to give us a call, or even your local acupuncturist, to see if they work with neuropathy. We'd love to have a conversation about your specific situation and whether our neuropathy program is the right fit for you. You can learn more about what we do at awpensacola.com, or just give us a call at 850-530-1028. We don't do any booking online, but we'll talk to you directly, and we want it because everybody's a little different on the symptoms and everything they come in for. So we want to make sure we're the right fit for you. And we serve the Panhandle and even into Alabama. We have patients coming from Brewton and Mobile. So I hope you have a great day. Thank you for your time. We'll see you in episode 3.